I perform what is called the nerve conduction study, and what it is it's checking the nerves by giving the nerve a little shock. The machine will show the response the nerve makes, and it measures the response. When we're done with this part of the test, the doctor will come in and do what's called an EMG. It involves a little needle that has a recording device at the tip. He or she will place it under the skin surface in the muscle, and we'll listen to the muscle. It's going to involve little shocks, so it's going to be a little uncomfortable, but it's just a portion of the test is uncomfortable. It gets a little bit easier as we go on and they get used to the shocks. I never will give too much shock so the patient is terribly uncomfortable. It's tolerable. The EMG portion is really almost like a little pin. If anyone has had acupuncture, it's very similar to that. It's just a little pick, that's all they're going to feel. There is no shock with the EMG portion. I have seen patients after the procedure, like a day or two afterwards, and I've never heard any complaints. Occasionally you might, with the needle portion, get a little bruising, but nothing more than you would get from a lab draw. Before the patient comes in for the test, they should shower to remove their skin of any oils. Before the test, if we are checking, let's say for instance with this patient, the left arm, I ask that you don't put any lotions or creams on this arm before the test, because our little electrical stickers here will not stick to your skin. We start out by cleaning the skin with just a little alcohol. So if you have any allergy to alcohol, you would let us know before the test, then we would use something different. We're then going to measure where we're going to be stimulating the nerve. And then we'll place little sticky electrodes onto the area of different muscles where the nerves run through, where we're going to be stimulating. And we're going to attach the electrodes. This is a little stimulator that's going to give off the shock, and it's going to direct it to the nerve. When the nerve feels the impulse, it's going to react, and this machine here is going to show us how your nerve is working. Ready?
Yes.
You're going to start to feel a little shock now. What we do is we increase the impulse as we go on through the test until we check all the different nerves, for instance, that come from the neck down to the fingertips on this arm. Once the test is completed, the patient will wait, the doctor will come in, the doctor will perform the EMG, which is a very tiny needle, like an acupuncture needle, very small, has the recording device in the tip. The doctor will place it in different muscles, and the machine will be able to record the muscle, the actual sound the muscle's making, and the doctor can determine if it's a normal response or not. The patient won't have any problems after the test as far as pain or bleeding. They can go home and do everything they normally do, and shouldn't have any problems after that.